This is the Wizard, WZRD Chicago 88.3 FM. We have with us at Wizard Kathy Powers, advocate extraordinaire. She is advocating for the less fortunate, the ones who don't have voices in the community or anywhere else. She is there to support them. And she has been homeless before, so she understands how it feels and how it is to not have resources. Kathy, welcome to WZRD.
Oh, yo, Wizard. Glad to be here. Glad to be here. What do you want to talk about?
Well, please describe your background and how community advocacy became your career.
Well, I grew up with a mother who wouldn't let me have a voice. And I went to 12 years of Catholic school where I didn't have a voice there either. And I had a number of nervous breakdowns, including attempted suicides. And I gotta say, my big push of being an advocate was when they closed my city mental health center in Rogers Park. And at the time I was depressed. And when it happened, it like struck me like lightning that this was wrong, that this was something I could complain about and advocate about and work on. And that was in 2012, and I'm still doing it. There.
We know that you're very active in the arts as well. So how does art come to factor into your advocacy work?
Well, mostly I've been a journalist, and I still am a journalist. Sometimes I just write here and there. I've written poetry and stuff for a long time, and
before you became an advocate.
Yeah, I think I did. I know now, like on Facebook, all the people who knew me in high school said, "You're a poet. Who knew?" It's like, yeah, well, it's always been that way, but I had no voice. It's amazing when you have no voice, what doesn't happen and what does happen, how people meet you and understand you or don't understand you, as the case might be. I said and I'm not supposed to say Sorry, listener. Sorry, Wizard. I lived in the Philadelphia area for 25 years, and there was it was difficult. I lived in South Jersey, so I'd have to go over the bridge into Philadelphia every day to work, and I worked for an extremely capitalist firm. And I'll name names now since they can't fire me anymore. Price Waterhouse. I worked for Price Waterhouse for 20 years.
As an accountant?
Well, you know, I have a son, and I raised my son. I'm a single mother, and it worked out. It worked out until the bosses started yelling at me at the top of their lungs with the doors closed, of course, but everybody could hear it, for me not to be late. Well, I have bipolar 1 disorder. And what that means is, to me, and why I really can't work, why it just doesn't work out, is I will sleep like 4 days in a row. And I'll be awake for like 4 days in a row. So after like a 4-day in a row being awake, I'm really dragging, and it's really hard to get into work. So I would be late. And the last time I got yelled at about it, I worked for a farmer who would get up like at 3 in the morning to do his farming stuff and then come into the office. Who knew that happens at Price Waterhouse either? And he didn't really have very much for me to do. I would come in late and he'd be pissed. And then when it came time for my review, like I was expecting a good review, because I always made up my time. I always finished my work. You know, I did what I could. I just did what I could. Well, he yelled at me at the top of his lungs, and I cried and I cried and I cried, and I thought, I can't do this anymore. I had another boss who did that to me. I can't do this anymore. My son was like a sophomore in high school. And I was going to Penn's weight loss clinic, and they thought that I belonged in the hospital because I was so upset. And so, I went there. I didn't want to go there, but, when they kind of put their arms around you, you got to go, right? Not so much anymore, but things are better now. I went back to work, and work was way over because I was in the ER forever and a day, because that hasn't changed at all either. If you have mental health problem, you're in the emergency room for hours and hours and hours, and nobody's with you. So you can imagine if you're upset, you have nobody to talk to, and it just kind of makes the thing all worse. It isolates you even more. So they let me go. And I went back to work, and I finished my work, and then I came in the next day, and another boss called me in and said, I see you were here like at 11 o'clock at night doing work, and, why did you do that? And I said, well, the customer was expecting a product, and I had to do the product, and I got it done. I said, but I can't do this anymore. I have to leave. And I tried to explain to him what my problem was, and he just really was kind of sad. I think he kind of got it, but he was kind of sad that he couldn't accommodate me. Well, those were the days when accommodation weren't anything at all. I do recall the law came in, and I signed a sheet saying, yeah, I need accommodation, or I have a disability.
At that time, there weren't any disability rights, right? When did that start? Much later?
Let's see. The ACA is, 28 years old now?
But it wasn't as well enforced at that time as it is now.
Yeah. It was.
What about now? Do you think the ADA is well enforced?
No, not at all. Not at all. Not at all. And you can ask anybody at ADAPT how well it's enforced. Why you can't go into a store and buy something because there's one stair there. If you have a wheelchair, one stair there, you can't go in. You just can't go in. I look at Chicago Avenue, which is where Access Living is. Mm-hmm. I didn't mean to knock that. And there's all kinds of stores there on the way down Chicago Avenue from like the Red Line. I take it from the Red Line. The stores are all downstairs. They're all downstairs. This is in the area where Access Living is, and I just can't even fathom why it's that way. No, disability rights are. If you have a disability, you are one of the people who don't have a voice. You're considered garbage by the capitalist society, and you can't make a big buck for them, and they're not interested. They're just not interested.
George Blakemore, who speaks in the public comment section of all government meetings, described how religious, educational, and government entities tend to pursue funding rather than results for those whom they serve. How true is this?
He is spot on, like always. George Blakemore is kind of my secret. I don't know. I can't believe he goes to every single city hall meeting and council there.
And he uses public transportation too, doesn't he?
Oh, yes, he does. Yes, he does. And he's very, very loud about it. I've talked to him a few times off. We're kind of buds. We recognize each other now. He is so right about that. We live in a capitalist society where the bottom line is money. Healthcare, money. Civil rights, money. Anything that they can make a buck out of, they're going to do it. And we have to stop them. We have to tell them that housing is a human right, that health care is a human right. Otherwise, we're going to perish. And when we perish, they're going to go too. I don't know who's going to empty their garbage. I just don't know. I really don't know.
How can we improve accountability among these entities?
Well, right now, I feel that it's solely on the people to do this. I don't think any of the legislators are going to do it. And I think it's up to us, we the people, to get out in the street, to vote too, although I'm not too sure about voting either. I think that's a little screwed up too. But to get out in the street. And yesterday there was a wonderful action in Elizabeth, New Jersey. All kinds of people came. And there was an ICE detention center there. Oh my God. And they were chanting, "Not one more." And people got arrested and stuff, but it went on. It was beautiful. Imagine, in Elizabeth, New Jersey, there's a detention center. Well, you know where our detention centers kind of are in Chicago? We have a lot of the children at Heartland Alliance. And I know there's been some actions there, but people don't realize these are kidnapped children. And Heartland Alliance is making a bunch of money off of taking care of them. Or not taking care of them. How would we know? How would we know we're not there? We have to be there. The people have to be there. And the people will do it. The people will do it.
Do you know of any groups that are advocating on behalf of the children around
us?
Yes.
Well, I know Black Lives Matter has been interested in it. I haven't been to any of their actions. They had one action 2 weeks ago every day. I fell on my face, so I've been out of commission for a week. I don't know exactly who was there. Kind of with these kind of things, these are different groups coming together. Probably the No Fascism group is there. Maybe. They're going to do a thing on July 4th. I'm just letting you know now. We're going to, and it's good about ICE detention. So I'm looking forward to that.
How did you come to serve on the Community Mental Health Board?
I was a client at the Northtown Rogers Park Mental Health Clinic. And I was there like from 2009 to 2012 when they closed it. The deal with I was the supervisor of the clinic asked me if I would join the advisory board. The idea was that every clinic would have their own advisory board. You know, what's going on, what's not going on, what they want, what they don't want. And then we would either all go en masse or something to downtown to the big mental health board. Well, I was the only one at my center, and I imagine at one time it was big. It was really big because we had 23 clinics. 30 years ago we had 23 clinics.
And how much do you have now?
5. Thank you, Rahm Emanuel. Good riddance. I would go, well, we'd have these meetings, and it was kind of scary up on Howard Street then. We had meetings at night. It was kind of scary. I would go, and then I would go to the downtown meeting, and I've been going to the downtown meeting ever since, so it's about 21 years. Oh.
Do you know of any work that the board did that was successful, or did the administration just have you there and not address the issues that the board brought up?
Mostly they don't address them. We had a thing going where we wanted a mural project at the Lawndale Mental Health Center. The Lawndale Mental Health Center is a boarded up garage. Has brown boards on the outside. even the bus drivers who go past it on Roosevelt, it's at Roosevelt and Campbell, they didn't know there was a mental health clinic there. It's been there forever, I think.
Do you know how many patients they have there?
I have no idea at all. We haven't been there in a while. They're going to move it. It's not accessible.
And this is one of the 5 that are left? This is the one that they
Yes,
left?
yes, that's it. MOPD came in and did their assessment because we complained they couldn't get in the doors and stuff. Big grated doors. Unbelievable. Really horrible.
MOPD?
Nice inside. Listen, I gotta say, nice inside.
Okay. MOPD, who is that?
That's the city, I don't know exactly what the acronym stands for, but they check out accessibility and they make sure that public spaces are accessible, like a city clinic, for instance. So their answer was, this is so bad, we can't even fix it. That was their answer. And, well, we're going to move the clinic. That was 3 years ago. Next year we said, well, how about the mural, right? How about the mural? We want the mural. It'll look better anyway. And they said, we're going to move the clinic. Another year goes by. We're going to move the clinic. Now we have an address, 111 Southwestern. I don't know if it's really going to move or not. So now there's a mural project at the Greater Lawn site, which has butcher paper. It was a grocery store, I think. It has butcher paper in the windows. That's what. And it had Mayor Daley signs in it. It was like, Myron Emanuel did not address mental health. He turned his back to it. He didn't even care that his name was on a facility. And good riddance to him again.
What indications are there that Mayor Lightfoot is addressing mental health concerns?
I don't see any right now. The task force to determine whether, what kind of mental health needs the city needs has met twice. Once behind closed doors, which I wrote a very sad song about because they wouldn't let me in. I'm a member of the Community Mental Health Board. It was a meeting of more than 5 people, and according to the Illinois Open Meetings Act, I was supposed to be let in. Plus George Blakemore was there, and 2 other people were there, so 4 of us couldn't go in. The city does that all the time.
Yeah, George Blakemore was able to go in?
No.
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 Okay, I see. And it's not recorded either. It's not videoed.
No. No, Alderman Cardenas did say something like, well, it was the first time and I wasn't too sure. I didn't want to make a fool of myself.
And
I think he did.
Were there any people who did public comment there that you know of? Did they admit?
Well, what I do know and what really, really, really annoys me is Sophia King was in there. That's it. She's not a task force person, but she's all for mental health. She's the one who came to our big meeting a couple weeks ago, came in, said her piece, and left right away. And everybody were telling their stories. It would make you weep. People have been in jail 28 years, beat up by John Burrs. How do you wrap your head around that? How do you wrap your head around that? So all these stories, and so Sophia King left. But Sophia King went to this first meeting with some of her friends. I don't know who they were. I get that. This is secondhand information, but the sources are reliable. And there were, I think, a couple more people from the Chicago Department of Public Health. They are not a friend. They are not a friend. They don't think that mental health belongs under public health. I don't know where they think it does belong, but they don't think it belongs under public health, and they don't want to deal with it. We're not worth it. They can't make a buck off it. They can't make a buck off it. So when you hear these aldermen saying, "Oh my God, mental health, da 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 da," don't believe it. Just don't believe it.
Does the Community Mental Health Board attend to Chicago public mental health concerns or to Cook County public mental health concerns also?
Presently, it's just Chicago. But the city is trying really, really hard to bounce it over to Cook County. That's I don't know what's going to happen with that. In the meantime, some of us will go to the county board meetings and see what they're up to and maybe give a statement, maybe not. It's too new to say, but Roseland was a city mental health clinic. And the county took over Roseland and said, okay, we're going to make it a crisis center or a trauma center or whatever they called it. And what happened was that it shut down and the people had to go to Stroger. So if you lived in Roseland, which is, way, way at the south end of the city, you had to come into Stroger. It's not easy. And the idea of community mental health centers is that it's in your community, where you are understood, where you know what barriers you have, where you know what resources you have or don't have. Every community is different. Communities are important, and they are the mainstay of the city. And the public health has stripped us of that as far as mental health goes, in my humble opinion.
This is the Wizard, WZRD Chicago 88.3 FM. We will continue with Kathy Powers' interview. She is the community advocate extraordinaire. So, Kathy, the 5 clinics, how are they spread out across the city? Is every part of the city, does every part of the city have a mental health clinic, or is there a desert somewhere?
No. Four of the clinics are on the south side. So I already talked about 2 of them. There's one in Inglewood and one in like back of the yards. Okay. So those are the 4 on the south side, and on the north side we have the one at River North. That's it.
So the north side is underserved.
Well, if you hear the Southsiders say it, no, we the grass is greener up here. I think they think that because we have more mental health places like Trilogy and Thresholds, C4, I'm not going to say C4 much, that people can, go to, except that if you're not insured, if you're coming out of prison, if you're homeless, you can't go there. You can't go there. You don't have any insurance dollars following you. You can't go there. So I say the whole city's underserved. South Shore has nothing. South Shore has nothing, including they don't have food stores. They don't have anything. I went to a on the table discussion at South Shore, and they're a traumatized neighborhood. They're a traumatized community. Shootings all the time. And what struck me the most was in the conversation, besides the pain and the feeling of being overwhelmed, like the men were there saying, well, where are the men to run the communities, That's really not what the problem is. You could have 1 million men there, and if you don't have the resources, it's not going to happen. What struck me was, you ready? After a shooting, and they take the corpse away, they don't have any counseling for the family or anybody who even saw it. It's pretty common. They don't wash away the blood. How much trouble would that be? That is so disrespectful. I'm still struck by that. It makes me shake. It just makes me shake.
That would cause a lot of fresh mental health issues among the community.
Absolutely, and it's a slap in the face. It's like your blood doesn't matter. Not only that, having that blood out there, that's a health problem. Blood is dirty. blood is very dirty. You got to clean that up right away.
Maybe one of these days someone will call the health department about that and see what the health department does. Report it?
We'll see. See, it's up to the people.
It is.
Again, that's what I say. It's up to the people.
And that's why you work so hard. How does the Community Mental Health Board work with the Commission on Accreditation of Rehabilitation Facilities, or CARF, C-A-R-F?
Okay. CARF is the organization that comes in and sees that your boat is afloat, so to say. They have recommendations that the city never does because it costs money. You know, we got to remember that anything they tell you to do, it's going to cost money. I don't know how much money it costs to wipe up blood, but that probably costs money too. I don't know. It's horrible. It's horrible. What we do, we read the report. We get the report, we read the report, we read the recommendations, and we see what they do or they don't do, what the city does or doesn't do. And if it's something that we think it's like really important, we'll push. We'll push on it. The city hates us. They hate us.
What are some of the issues that you're pushing?
Huh?
What are some of the issues that you are pushing?
Right now, just the accessibility issues, and now they're talking about bringing in telepsychiatry. And I just read from my girlfriend in Philadelphia who works in the mental health field. She said telepsychiatry could be good if you had a psychiatrist who could speak English or speak Spanish, whatever. They don't necessarily speak what most of the people speak. I'm not saying they have to be multilinguists or anything, but I thought about that part. I never thought about that part. What I did think about was first of all, the telepsychiatry companies, they're private, right? Mm-hmm. And working with a public agency. So they're sucking up some money, and why can't the city psychiatrists do it? I don't know. We question this, and they ignore us. What we get from the city for our monthly meetings, we will get a readout of the psychiatry coverage of all the places, all the centers. We were, only half covered for the last 4 years, I would say. And then we had a psychiatrist who retired. That means that out of 5 days a week, only 2 days would be covered in one area or another, and with a little sprinkling here and there. I would say it's a half. Look like that to me. We get a little graph thing. That's what it looked like to me. But now they finally hired somebody. They had an opening for years, and we never could find where they posted it. And I have a feeling they didn't post it. We're not stupid. I think we could find some things if they were posted. So they did hire somebody that we didn't even know about. Boom, there it was. But they won't even come and talk to us at our meetings anymore because we don't speak properly to them. They wanted us to go through, are you ready, a training program on how to talk to them. So I guess we were bad people. And when that happened, I missed that meeting. There was some sparks flying at a meeting that I missed.
Did they actually facilitate that training program, and did some people actually take part in it?
No, we wouldn't. We thought that was incredibly disrespectful. We were upset. Some of us are recovering mental health clients, and some of us are old retired mental health workers from the city. you know, we don't like the way they talk to us either. But we keep talking to them mainly because we have to, I guess. But I thought that was horrible. I thought that was horrible, and it's been that way. It's probably been that way about a year. What it used to be is we would have our meeting, and we'd meet for an hour, and then the city people would come in and, you know, say whatever they were going to say. And we might say something back to them that, well, like, yeah, whenever we asked for anything, that was like, how dare you? How dare you? That's how we acted.
Did your group address the training program to the city and let the city know that you're not happy with that?
Oh, I think they know. I think they know. We didn't. Oh, one time, Julie Marita, who is no longer the Commissioner of Public Health, but while she was, she said, well, she'd be willing to meet with 2 of us at a time. And we said, no, you meet with the whole group or you don't meet with us at all. And so we didn't meet with her.
Did she say why she wanted to meet with only 2 at a time?
Probably so she could handle us. She probably would cherry pick who she wanted to. I don't know.
How many mental health facilities need accessibility upgrades, and what other upgrades do these facilities require?
Well, I don't know where Lawndale's going. The boarded up garage at Roosevelt and Campbell, but they're going to move to supposedly 111 Southwestern. So that's good. That's good. I haven't been to 111 Southwestern. I shouldn't make my determination. Greater Lawn has accessibility issues, but they are fixable. And there is a mural project in there now, which is good. It looks a lot better than butcher paper. And I assume that Lori Lightfoot's name will be on the sign now instead of Mayor Daley. Maybe. That's just my assumption.
So I guess that Ram wasn't interested in having his name there or his picture.
Oh, yeah. And, you know, he had never mind. Just something personal about him. He had issues in his family. And, you know, knowing the kind of person, you know, he's very high-strung. And I just think that he just couldn't deal with it. He just couldn't deal with it. And if he couldn't deal with it on a personal basis, he certainly couldn't deal with it on a city basis. And for that, I'm sorry for him. I am sorry for him. Maybe he'll help the hedge funders. Maybe.
Were there any changes to the board operations, the Community Mental Health Board operations, and how can these changes improve the board's efficacy?
In the last few years, we've had kind of a turnaround about like who's running it. We have an excellent person who FOIAs everything, absolutely everything, and when they tell her no, she appeals it. She gets everything that we possibly want. You know, since she's been around, you know, it's been a whole new way of thinking, of dealing with data instead of just, you know, personal issues. It's more professional, I would say, and I have great respect for her.
At the last Community Mental Health Board meeting, were there any public commenters?
Yes. Angelica Rosales was there, and she's the head of the collaborative. I don't know exactly what the it's a whole big long name, collaborative, and it's based in Pilsen, I believe. And I would love to live in Pilsen. What a great community. They fight for everything. They know what's what. I love Pilsen. But from Northside now. She comes to every meeting. She comes to every meeting. She tells us what's going on with the collaborative, including this mental health thing that we had. We had it at Malcolm X, and the room was full. That's a big room. The room was full. And that was the one where Sophia King came in and did her little tap dance and left. And everybody else, we even ran over. They gave us, first they were giving us 3 minutes, and then they were giving us 2 minutes. And we're all yelling, yeah, like City Hall, you get 2 minutes. And they're all kind of laughing. But they were so respectful. And they just recently had a meeting about what they found out from the meeting. What I found out was that there are a lot of people out there with a lot of stories, need resources, and they should get them. That's what I read. Fran Tobin was with me too, with the Alliance for Community Services, and STOP was there, Southside Together Organizing for Power. They've been holding the bridge for the mental health movement. I used to be part of that too. But that kind of fell apart and then came back again, and it is on the south side, and I can't do it anymore. I'm old. I'm really old.
Please describe your advocacy for the homeless. How does advocacy for the homeless compare with advocacy for mental health?
Homelessness is a physical restraint of shelter. If you look at the Maslow hierarchy of needs, you have physical, which means shelter, which means food. The second one up is safety, so already, they probably don't have enough food. They're certainly not very safe outside. And when you come up to the third thing, socialization, people who are homeless become more and more isolated and distrustful of whatever's going on. Whatever somebody's telling them, they're not going to believe them. And you can't blame them because they've been told so many stories before. And my quest to find a home, I found out that you'll go to all these places that are resources for homeless, to get a home. And they put you on a list. And they send you to another place that puts you on a list, that puts you on a list, that puts you on, I'm on a lot of lists. I'm paying 82% of my income. And I just can't, I don't know how long I'm going to be able to do that. Compared to, if you are in the situation of being homeless, of not having food, of not having safety, of not having shelter, even if you went in 100% mentally well, you can't keep it up. It's a need, and your life can't handle it. It just can't handle it.
Do you have any suggestions about how the city could help the homeless that would work?
Sure. Buy the empty houses that the banks are holding for no good reason and shelter the homeless, period. The tiny homes thing is a good thing where they're talking about building these tiny shelters, especially here in Chicago, for Chicago winter, to at least get somebody in and warm. But it's only a temporary solution. You got to get a real home. A real home. Tiny homes are not real homes.
You have to get into a real home in order to progress. Otherwise...
Oh, yeah. And people don't seem to understand that most of the homeless people work. They work. Sometimes they work 2 jobs. They still can't pay the rent. They can't pay a rent. That's incredible. What kind of country do we live in that goes on? And while they're at work, they have to find somebody to watch their stuff, or somebody's going to steal their stuff. That was what was so beautiful about Uptown Tent City. They actually had a organization there where somebody would watch the stuff, and people would go off to work, and people would come back and they'd watch the stuff. It was very organized. It was very clean. It was what the city really was trying to do was drive them out anyway. Like, how much would it cost to put a porta potty in? It couldn't be that much. I just really don't think so. So the people
Might
that
have been cheaper than clearing them out.
I would think so. I would think so. But people would put their trash in the trash cans, and the city wouldn't pick up the trash. So it just got more and more trashy. Not the people's fault. And it was all on purpose. I'm sure that was a Alderman Kappelman thing because he wanted to get rid of them. The people that he built this huge luxury high-rise at Montrose and Clarendon. Just feet from where the homeless people were. He used TIF funds with it to build it. Now that wasn't right. TIF funds are supposed to be used for some kind of building type thing that if it weren't for the TIF funds, it wouldn't be built. Mm-hmm. These are rich developers who built it. They can afford it. You know, they're going to make a fortune off it. But, you know, what I say about capitalism is it's got to be that, you know, you got to get that last dollar. You want me to talk about the lottery tickets? I'm fuming about lottery tickets. You see people buying lottery tickets, very poor people. You can tell they're very poor people the way they dress as that. It's like sitting at the bench at Jewel and scratching off the numbers. This is capitalism, stealing these people's last dollar with the hope and the dream that they're going to have enough money to make it. And I think that's cruel and horrible, terrible, and I'm really worried now about the casinos coming.
Please describe the work of the Alliance for Community Services. Do they concentrate on the homeless and mental health? What are they all about?
First of all, the Alliance for Community Services would not be there except for the Northside Action for Justice. Mm-hmm. Northside Action for Justice is a real grassroots advocacy group. We only fly by our members' dues and what our members say. One Northside can't say that. They scram.
In other words, you don't get any public funds. It's all donation based.
That's right. Occasionally we'll get a grant or two from the people who are, it's all right for us to take grants. They're not going to tell us what to do because we're very specific about that. Mm-hmm. Now One Northside, I asked my organizer the other day, I said, why is it that when, we do group things with One Northside, they always take the credit? It's just, we're in it together, we're for the same purpose. And he said, I'll tell you why. He said, because they get money for it, they get grants for it, they get famous for it. It's a big PR thing. They do I don't want to knock them. I do not want to knock them. They get a lot of things done that we don't have the capacity to do, but we don't whore for the money either. And I just want to say that. So the Alliance for Community Services started, God, I think it's almost been 5 years now. I can't believe it, but about that long. And our idea was that we were having, our community, our people were having trouble with getting human services through the state. And my organizer, who is brilliant, I would say his name, but he probably wouldn't like it, so I won't. But he's brilliant. He's absolutely brilliant. And what he did, he said, you know, the union for the state workers, they're not having a good time either. They're being blamed for everything, for this broken system. And wouldn't it be cool if we united with them? We, the people who receive the services, and those people who actually give the services, unite together in an alliance. And we did. And we did. We united with ASME. Now we've got...
So that was the flashpoint for bringing the Alliance for Community Services together.
That's right. That's right. Now we have 4 ASME locals, I believe. We have STOP. STOP is a member. Northside Action for Justice is a member. And I'm missing somebody. Somebody new. I'll know them too, but the union. Oh, the union. What's so great about it is that we, with this being done like this, we know what's going on behind the counter. We know that the system, the new Deloitte, it's probably up to $1 billion now system that they bought, because they want to make human services kind of like a Ford assembly line. You go to station 1, you go to station 2, you do that. Well, that doesn't work with people. First of all, documents get lost. So if you're at station 2 and they say, oh, we can't find your documents, you gotta go back to station 1. It's horrible. The computer itself breaks down 1 to 2 times a week, statewide. Oh, I hope you get that out. I really hope you get that out. A lot of the documentation gets lost because the system was built, and at 5 o'clock, every office sends in their scanned documents, and it goes through a portal. They can't handle it. So whatever doesn't make it through the portal doesn't exist. People don't know that. Now
it goes by the wayside, is not killed.
You have to start all over. They'll say, we didn't get your bank statement, or we didn't get blah, 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 blah. Whatever they're going to say. I just did my redo thing for Medicaid, and for some reason, they scheduled me for a different office. They scheduled me to go to Skokie. Now, the one at Hiawatha that we're screaming bloody murder about, because that was away from Uptown, Lakeview. Everybody has to go to Hiawatha now. That's a long trip. If you have any disabilities, which you probably do, it's very, very difficult, and, you know, kind of a Rauner thing. You know, just to make things as hard as it possibly can. Keeping it within the city limits. They've done it on the south side, too. I'm not familiar with the south side that much, but within the south side. So they take you to the very edge of the city. So that if somebody says, oh, well, you took them all out of the city. Oh, no, we have lots of offices in the city. Now, you can't see.
So there was a pattern of actually assigning interview sites at a site that is furthest away from the client's residence.
Some people, yeah, it's crazy. It's crazy. And, you know, if people don't know to fight, people have to know to fight. People have to know. Again, the people. Now, the offices are, you can only see a caseworker 3 days out of 5. That's kind of like being in a post office and saying, on 2 days, we're not going to sell stamps. It's horrible. I tried to talk to Greg Harris about it. Why don't you just send out a letter telling people? He said, well, each office is different. I said, still, every office is, why don't you send out a letter just saying what days You can go see a caseworker on what days you can't. Now, if you're a fool, you'll go in on those 2 days, the processing days, that you can't see a caseworker, and drop off your paperwork into what I call the box of the black hole of death. Nobody ever sees that stuff. Nobody sees it. They haven't ever since I've been in the system. That is what we're working on right now. We had planned to have a presentation for Grace Howe, the Secretary of Human Services at Truman College. And 3 days before, and the union was going to host us. That's how we got the space. The union hosts us, and they can host whatever they want because of the union there, and that's in their contract. 3 days before the event, my organizer got a call saying, you can't have the space. Well, why can't we have the space? You know, we started all that stuff. And it just, the City College administration, the president said, it's not a union meeting. Who's he to say what a union meeting is? The union wants to meet with the public. That's their deal. So we're working on having this meeting the end of July. We want Grace Howe to listen to all the stories that we have. I remember once I went to a town hall, and there was a guy there. It was a Friday night. Guy there who said his Medicaid was cut off on Thursday. Doesn't know why. He was on dialysis, and he missed 2 dialysis appointments. That could have killed him. Fortunately, he's still around. I know he's still around. But people don't realize what's happening with people. It's just.
What is your advice to students and the community for getting involved in addressing issues such as these that nobody knows about?
I'm sorry, I didn't hear you.
What is your advice for students and the community to become advocates for these issues that most people don't know about?
Speak up. Talk to your neighbor. I talked to somebody on the bus. I never thought I would be doing this. From no voice when I was growing up. I'm on a alcohol-filled Broadway bus last night, and one guy was saying to the other guy, "Well, why didn't he move to the Lincoln Avenue office?" And I was listening, and it's about Andre Vasquez. And then the other guy said, "Well, gee, I don't know." And I leaned over and I said, "Because they couldn't get the stink out of the old office. That's why." Same thing with Maria Haddon and Joe Moore. Just like I said, corruption stinks. And you got to get that out of your furniture. That's what I said. These are things I do, just on the bus. I talk to people at bus stops. I talk to my girlfriend who likes to stick her head in the hole. But she got all excited. I turned on the Medicaid for All protests, and I said, "Oh, I'm in it." I didn't know I was in it. I'm in it. And she started looking at it, and she said, "Well, my husband works, and he has insurance, so this isn't for us." And I said, "Oh, yeah, it is." So then I told her, I said, the insurance companies are hiking up the premiums, and it's happening to your employer too. So he's either going to get a cheaper plan for you or drop the plan altogether. You don't know what they're going to do. Medicare for All is the bomb. And I'm really ashamed of NBC for phrasing a question like they did the other night. They said, who here would be willing to get rid of all the insurance companies and have the government run your insurance? That's not how it works. That's not how it works at all. But that's, the corporatists don't want this. The insurance industry don't want this. Big Pharma doesn't want this. And I say the hell with them. Medicare for all.
Well, Kathy Powers, thank you so much for joining us on Wizard and giving us your insight about advocacy and about issues that people really will talk about.
I hope they do, and they can talk to me whenever they see me.
Thank you, Kathy.